video, I will talk about the 8 signs you need to report to the doctor after giving birth. These 8 signs and symptoms are worrisome and need immediate attention to avoid further complications and possible death. By prompt reporting, it ensures your safety as a patient by timely action from the doctor to intervene to avoid further harm. During the postpartum period, a woman who has complications needs to proceed to the labor and delivery unit instead of the emergency department. Postpartum period is defined as a period from birth of the baby to 6 to 8 weeks after delivery. Welcome, parents! This is Nurse Cherry from Mother Baby Central, where I help parents, family members, and caregivers provide the best care to moms and babies during pregnancy, postpartum, newborn stage, and baby's first year of life. I have been posting a lot of baby care videos lately, so I feel like it is time to give the moms some attention and love. After a woman gives birth, everyone is just so excited and happy on the arrival of the new addition to the family. Sometimes, though, through the busyness of taking care of a newborn, moms neglect to include her needs in the equation. If she feels under the weather, she thinks it's just because of the lack of sleep or just being tired. In this video, I will highlight the 8 danger signs you need to report to the doctor immediately. These signs usually occur from a few days to weeks after the baby's birth. So, without further ado, let's jump into it. Number 1, fever. Check your temperature if you are feeling feverish or warm to touch. Any temperature greater than 100 degrees Fahrenheit or 38 degrees Celsius is a fever. Usually a fever is accompanied by other symptoms too. So identify those symptoms and write them down so when you call the doctor, you can tell them specifically what is going on. For example, you need to say when the fever started. Are you also having some pain with it? How often? What makes it better or what makes it worse? Have you taken any over-the-counter medicine? Things like that. Infections can originate from different sources. It could be from the breast, the uterus, or the incision site if you have a C-section, or on the perineum if you had an episiotomy or laceration with repair for vaginal delivery moms. It could be from the veins on the legs or any part of the urinary tract system like the bladder. Each part I mentioned borders specific bacteria causing the infection. So the more specific you are in relaying your symptoms, the more clear you will sound to the doctor, and she will have baseline thoughts on what is going on. Number 2, passing large blood clots. If you pass one big clot, just watch out and monitor. And if the clots come one after the other in large amounts, accompanied with some lightheadedness, it means you are hemodynamically unstable. Safety first, so make sure to sit somewhere to avoid falling because you might eventually pass out. A common reason for passing large amounts of blood clots is retained placental fragments. The doctor needs to know the symptom if it occurs because you need to have some tests and probably some imaging done, like an ultrasound. Once the doctor identifies the cause, then they will proceed with the next course of action. Number 3, foul-smelling discharge. It is normal for a woman who gave birth to have a vaginal discharge, and it is called lochia. For the first 3 to 4 days, it is red in color and then turns pinkish on days 4 to 10 and eventually changes to like a yellowish white discharge. The smell is like a fleshy, musty menstrual blood odor, but never foul. A foul-smelling discharge means there is an infection going on, maybe a uterine infection. Before I continue, if you stick until the end of this video, I will share a bonus tip where I will give some helpful tips to keep mom healthy and avoid any sickness or complications during the postpartum period. So watch out for it. Number 4, heavy bleeding, which leads to hypovolemia or shock. The symptoms you need to watch out for is increased heart rate, where you feel your heart is racing. You can also count your pulse rate for a full minute to determine if it's high. So anything above 80 per minute is high. Cold, clammy skin, pallor or pale skin, blurry vision, weak pulse, and severe dizziness. How would you know if you are bleeding heavily? Aside from the symptoms I just mentioned, you can also monitor the peri pad. Put a clean one on after an hour, check the pad. If it is soaked and heavy, it means you're bleeding more than the normal amount. Number 5, increase in pain in the perineum. This is for the woman who had a vaginal birth with probably some episiotomy, laceration with repair, or any form of assisted vaginal delivery with the use of a vacuum or forceps, which probably can cause trauma. One of the reasons causing pain is possibly a hematoma. Hematoma is a pool of blood formed in the closed skin, which causes hemorrhage, infection, and anemia, leading to the need of a woman to have blood transfusion. Number 6, unilateral leg pain, either the right or left leg. Compare both legs for any differences you notice, like the temperature. Does the affected leg feel warm or cold? Is there tenderness? Is there redness? Or is there any swelling? Number 7, chest pain, difficulty of breathing, issues with skin or cyanosis, like the skin appearing blue, increased respiration and heart rate, heightened anxiety, and cough. These are signs of PE, or pulmonary embolism, a condition where there is a blood clot formed in the artery of the lungs. This can happen during or after labor and delivery, but still can occur days and weeks later. A person in distress needs emergency medical attention, so call 911. Number 8, headache, blurry vision, dizziness, swelling of the legs, and some epigastric pain. These are signs of pre-eclampsia. This condition is not exclusive during pregnancy. It can still happen during the postpartum period. Monitor your blood pressure at home after giving birth, especially if you have a higher risk for this condition. Before we end this video, let me give you the bonus tip. Here are some great ways to maintain health and avoid complications from birthing a baby during the postpartum period. First, hydrate well. Drink 2 to 3 liters of water per day. Second, maintain a balanced diet. Eat a variety of food, whole grain, fruits, vegetables, food high in vitamin C and protein to promote mood healing and faster recovery. Third, physical activity, light exercises, which includes walking, stretching, simple flexion of the arms and the legs, and other non-strenuous forms of exercise. Avoid intense workouts like abdominal crunches, running, lifting heavy weights, and others. This has to be avoided 6 to 8 weeks after delivery. Fourth, identification of a support system. Aside from your significant other, reach out to a group of new moms, or a breastfeeding group, lactation support, your close family members and friends who will be there for you during stressful times. Things always seems to be better if you have allies rooting for you and be present in times of distress. Fifth, frequent hand washing. Need I say more? This is the best way to avoid the spread of germs and introduction of unwanted bacteria into your body. There are a lot more tips I can share with you, so check out these 2 videos where I talk about care after a vaginal birth and C-section delivery. I will post the link in the description, so make sure to check it out. And there you go, parents, the 8 danger signs that you need to report to the doctor after having a baby. I hope you find great value in our content for the day. Please share it to someone who will find this information helpful. As always, be well everyone, make this day count, and happy watching!